Healthcare is incredibly complex. We want to make sure that the healthcare experience for our patients is safe, seamless, and personal. Because health information is so difficult to understand, we have financial counselors that help people understand their plans. And we try to help them when we register them and we learn what their insurance is, to let them know whether or not a test or a procedure needs to be pre-authorized, whether they need special permission to see a certain specialist.
When you're purchasing your health insurance, it's probably really important to understand the network that you're purchasing. And in our general market, there's two broad categories that people often talk about or hear about. It's a PPO and an HMO, preferred provider organization, and a health maintenance organization. A PPO generally will give you access to more providers than an HMO. Typically speaking, when you have an HMO, you have to first go to your primary care physician or your PCP, and they will direct your care and coordinate it for you on your behalf. In a PPO situation, you have the option of seeking out specialty care directly from specialists. You don't have to use your PCP. However, we always encourage any consumer to always have a good relationship with a primary care physician that can direct your care and organize it for you, because it is complicated, it is hard to navigate. Choosing a plan first and foremost begins with who is in that network of providers. So you want to make sure that the doctors that you're used to seeing, that you have a relationship with, are in that plan that you're making a decision upon purchasing or not. The second thing is, what's my out-of-pocket? How much money will it actually cost me to seek services? There's co-insurance, which is just usually a percentage of the actual bill that you are responsible for. And then there's co-payments, which are set amounts that are predetermined based on the plan that you buy. Some plans have deductibles. A deductible is a set amount that you have to pay before your insurance coverage kicks in. The insurance companies use it as a way to protect themselves from the low dollar expenditures. It also helps lead to lower premiums for consumers. And it's always wise to only use what you need. So if you're in a situation where you need to access care immediately, you're better off going to a walk-in clinic than going to an ER unless you really do need emergency care and you have a life-threatening condition. Health insurance is there to bridge that gap to ensure that you don't go bankrupt just by seeking healthcare services when they're truly medically necessary.